The bottle says healthy. The label says support. The commercial says energy, memory, bones, heart, and immune strength. But if you are over 60, the wrong supplement at the wrong dose, taken every single day, may be quietly working against your liver, your heart, your bones, and even your brain. I want you to picture something very ordinary. You open the cabinet above the kitchen sink or the little drawer next to your pill organizer, and there they are: vitamin E, vitamin A, iron, calcium, vitamin D3, vitamin B12, a multivitamin from Costco, a bottle from Walmart, a supplement your daughter bought at CVS, something a friend from church said helped her feel younger. And every morning you take them because you believe you are protecting yourself. But here's the question I want you to answer before we go one step further. What is the one supplement you take almost every day? Is it vitamin E, vitamin D, iron, B12, calcium, or a multivitamin? Type it in the comments now, because by the end of this video, you may look at that bottle very differently. And please hear me clearly. This is not an attack on vitamins. Vitamins can be life-changing when the body truly needs them. This is a warning about guessing, because after 60, guessing with supplements is not the same as guessing with a snack. Your liver, kidneys, stomach acid, medications, blood vessels, bones, and nerves are not working exactly the way they did when you were 35. The margin between enough and too much can become much smaller. One of the most dangerous myths in health is this: if a little is good, more must be better. That sounds logical, but biology does not work that way. Your body is not a storage garage where you can keep stacking bottles until health improves. Your body is more like a finely tuned orchestra. Too little of one nutrient creates a weak note, too much of another creates noise. And when prescription medications are added into the mix, that noise can become dangerous. I see this pattern all the time. A person feels tired, so they buy iron. Their memory feels slower, so they buy a brain supplement. Their knees ache, so they add calcium. Their friend says vitamin E keeps you young, so they take 400 international units every morning. Then they add a multivitamin on top of it, not realizing that the multivitamin may already contain some of the same nutrients. Nobody is trying to hurt themselves. Most people are trying to do the right thing, but the right intention can still lead to the wrong outcome. So today, I want to show you the 3 supplement mistakes older adults should never take lightly, especially when they are taken long-term without blood testing or medical guidance. The first is high-dose vitamin A. The second is high-dose preformed vitamin A, especially retinol. The third is iron, which technically is not a vitamin at all, and that is exactly why the warning matters. Then I will show you the nutrients many older adults actually do need to think about more carefully: calcium with vitamin D3, vitamin B12, and folate. But we are going to talk about them the right way, not with hype, not with fear, but with the kind of practical understanding that protects your independence, your walking, your memory, and your quality of life. Let's begin with the first bottle that looks innocent, because it is often sold as beauty, anti-aging, heart support, or antioxidant protection. I am talking about vitamin E, especially high-dose vitamin E capsules. Vitamin E is not bad. Your body needs vitamin E. It helps protect cell membranes from oxidative stress. It is found naturally in foods like sunflower seeds, almonds, peanut butter, spinach, avocado, and olive oil. When vitamin E comes from food, it arrives with fiber, minerals, healthy fats, and a natural balance of nutrients. That is very different from swallowing a high-dose capsule every day because you heard it keeps the skin younger or prevents aging. Here is the belief reversal. Vitamin E may sound like a gentle antioxidant, but in higher supplemental doses, it can influence how your blood clots. Think of your platelets as tiny repair workers. When you cut yourself or when a blood vessel is injured, these repair workers rush in and help form a clot. That is not a bad thing. It is one of the reasons you do not bleed endlessly from a small wound. But high-dose vitamin E can interfere with platelet aggregation and blood coagulation. In simple terms, it may make it harder for the body to stop bleeding normally. According to the National Institutes of Health, Office of Dietary Supplements, high doses of alpha-tocopherol supplements can cause hemorrhage and interrupt blood coagulation, and clinical trials have found increased risk of hemorrhagic stroke in people taking alpha-tocopherol. One major trial used 400 international units of synthetic vitamin E every other day for 8 years. Now listen carefully, because this does not mean every person who ever took vitamin E is in danger. It means vitamin E is not a harmless candy. The risk becomes more important if you are taking aspirin, warfarin, clopidogrel, Eliquis, Xarelto, or any medication that affects clotting. It is also important if you have a history of bleeding, a previous hemorrhagic stroke, uncontrolled high blood pressure, liver disease, or if you are scheduled for surgery. Imagine an older blood vessel like an old garden hose. It can still work beautifully, but it is not as flexible as it used to be. Now add high blood pressure, a fall, a bump to the head, or a medication that already thins the blood. If you then add a high-dose vitamin E capsule without telling your doctor, you may be stacking risks without realizing it. That is the quiet danger. You do not feel vitamin E thinning your clotting response. You do not feel a blood vessel becoming more fragile. You may simply think, I am taking something healthy. But the body may be dealing with a different story. So what should you do? First, look at the label. If you see 400 international units or more in a separate vitamin E capsule, especially if you take it daily, do not panic, but do not ignore it. Put it on your list for your doctor or pharmacist. Ask whether it is appropriate for you with your medications and your medical history. Second, do not combine multiple sources without realizing it. Your multivitamin may contain vitamin E. Your eye supplement may contain vitamin E. Your separate capsule may contain vitamin E. The total matters. And third, let food do what food does best. A small handful of almonds, a spoonful of peanut butter, a serving of spinach, avocado on toast, or olive oil on vegetables can give your body vitamin E in a safer dietary pattern. The goal is not to fear vitamin E. The goal is to stop treating high-dose capsules as if they are automatically harmless. Now, the second supplement is one that many older adults take for their eyes. It has a reputation for being simple, familiar, even wholesome. We were told from childhood that vitamin A helps vision. That is true. But the story changes when we talk about high-dose preformed vitamin A in pill form, especially retinol or retinyl palmitate. This is where many people get confused. Vitamin A from carrots is not the same risk as high-dose retinol in a capsule. Carrots, sweet potatoes, pumpkin, butternut squash, spinach, and kale contain carotenoids such as beta-carotene. Your body can convert some of that beta-carotene into vitamin A when needed. It is a more regulated process. Preformed vitamin A is different. It is already in the active family of vitamin A compounds. It is found in animal sources such as liver and fish liver oils, and it can be found in supplements as retinol or retinyl esters. Because vitamin A is fat-soluble, excess amounts are not simply flushed out in the urine the way many water-soluble vitamins can be. It can be stored, especially in the liver. Think of your liver like a storage room that also has to run a factory, clean the air, process chemicals, manage fats, help with blood sugar, and break down medications. If you keep putting boxes into that storage room every day, eventually the room gets crowded. High intakes of preformed vitamin A, over time, may lead to toxicity. Symptoms can include dry skin, hair loss, cracked lips, headache, dizziness, nausea, fatigue, and liver abnormalities. At very high levels, the consequences can become serious. The National Institutes of Health lists the tolerable upper intake level for preformed vitamin A in adults at 3,000 micrograms RAE per day, which is roughly 10,000 international units of preformed vitamin A. That upper limit is not a target, it is a ceiling. For older adults, especially those taking multiple supplements, eating liver frequently, or using fish liver oil, it is surprisingly easy to stack sources without noticing. But the liver is not the only concern. Vitamin A also has a complicated relationship with bones. Some studies have associated higher intakes of preformed vitamin A with lower bone mineral density and increased fracture risk, although the evidence is not identical in every study. The practical message is still very important. If you are older and already worried about osteoporosis, falls, hip fracture, or balance, you do not want to casually take high-dose retinol every day unless a clinician has a reason for it. A hip fracture in later life is not just a broken bone. It can be a turning point. It can affect walking, confidence, independence, the ability to live at home, and even survival. That is why I take this seriously. Not because vitamin A is evil, but because the wrong form and dose can create unnecessary risk. The danger is not a carrot. The danger is not a baked sweet potato. The danger is a high-dose retinol capsule taken every day because someone said it was good for the eyes. Your eyes matter, but your liver and bones matter too. So here is the safer approach. If you are taking a separate vitamin A supplement, turn the bottle around and read the supplement facts. Look for the form. Does it say beta-carotene, retinol palmitate, retinyl acetate, retinol? How many micrograms RAE? How many international units? If you cannot tell, bring the bottle to the pharmacist. If you already take a multivitamin, do not add extra vitamin A unless your clinician specifically tells you to. And if your goal is vision support, focus on a diet rich in colorful plants, leafy greens, eggs if you eat them, and ask your eye doctor whether your situation calls for a specific formula. Now let's talk about the third mistake, and I want to say this very clearly. Iron is not a vitamin. Iron is a mineral. But it belongs in this warning because iron is one of the most common supplements older adults take without testing, and it can be one of the most harmful when taken unnecessarily. Many people think, I feel tired, so I must be low in iron. My skin looks pale, so I must need iron. My hair is thinning, so maybe iron will help. But fatigue is not a diagnosis. Pale skin is not a ferritin test. Hair thinning is not proof of iron deficiency. Fatigue can come from poor sleep, thyroid problems, kidney disease, depression, low B12, medication side effects, dehydration, infection, heart disease, or dozens of other causes. Iron is essential. You need it to make hemoglobin, the protein in red blood cells that carries oxygen. When someone truly has iron deficiency anemia, iron can be extremely important. But here is the problem. The body has no easy everyday exit door for excess iron. You lose tiny amounts through skin cells, the gut, and bleeding, but you do not simply urinate out extra iron the way you might with excess vitamin C. So if iron is taken when the body does not need it, it can accumulate. Excess iron can participate in oxidative reactions, creating stress inside tissues. I often describe it this way. Iron is like a tool that can build or rust depending on where it is and how much is present. In the right amount, it helps carry oxygen. In excess, especially in people prone to iron overload, it can act like internal rust, irritating the liver, heart, pancreas, and joints over time. This is especially important for men and for women after menopause. Before menopause, monthly blood loss is one reason many younger women need more iron. After menopause, iron needs drop. According to the National Institutes of Health, adults 51 and older generally need 8 milligrams of iron per day. The tolerable upper intake level for adults is 45 milligrams per day. Many iron pills contain much more than a normal daily food requirement because they are designed to treat deficiency, not to be taken casually forever. If you take iron because a doctor found iron deficiency, that is different. If your blood tests show low ferritin, low iron saturation, microcytic anemia, or another pattern that your clinician is treating, then iron may be exactly what you need. But if you are taking it because you guessed, that is the issue. The tests that matter are not just how you feel in the mirror. Ask about a CBC, which looks at red blood cells and hemoglobin. Ask about ferritin, which reflects iron storage. Ask about transferrin saturation or iron studies if your clinician thinks they are needed. And if iron is low, the next question is why. In older adults, new iron deficiency can sometimes be a sign of blood loss from the digestive tract, including ulcers, polyps, or other conditions that should not be ignored. That is why I do not want you to cover the smoke alarm with a supplement. If your body is losing iron, you need to know why. If your body already has enough iron, you do not need to add more just because the label says energy. Now that we have removed the 3 risky mistakes, high-dose vitamin A, high-dose preformed vitamin A, and iron taken without testing, let's talk about the nutrients many older adults truly do need to think about, but in the right order, with the right dose, and with the right partner. The first is calcium and vitamin D3. These two are often discussed together because calcium is the building material and vitamin D is one of the key helpers that allows calcium to be absorbed from the gut and maintained in the blood. Think of calcium like bricks for a house, but bricks alone do not build a wall. You need someone to open the gate, bring the bricks to the right place, and help organize the construction. Vitamin D helps open that gate. This matters because bone is not dead stone. Bone is living tissue. It is constantly being broken down and rebuilt. After midlife, and especially after menopause, bone loss can speed up. For men and women in older age, the concern becomes not just bone density on a scan, but what happens in real life. A slip on the porch, a fall in the bathroom, a misstep in the garage, a hip fracture, a wrist fracture, a spine compression fracture. The usual recommended intake for calcium in older adults is around 1,000 to 1,200 milligrams per day, depending on age and sex. And for many people over 70, the common target is 1,200 milligrams per day from food plus supplements combined. For vitamin D, the recommended dietary allowance for adults over 70 is 800 international units per day. These are general recommendations, not personalized prescriptions. But here is the mistake. Many people hear calcium and immediately buy the largest pill. That is not the goal. Calcium is not about swallowing the biggest tablet. It is about getting the right total amount from the safest sources at the right time with the right partner. Food should come first when possible. A cup of Greek yogurt, a glass of low-fat milk, fortified almond milk, sardines with bones, canned salmon with bones, fortified orange juice, kale, broccoli, and calcium-set tofu can all contribute. Food calcium tends to arrive in a balanced package, and many people tolerate it better than large supplement doses. If you do need a calcium supplement, ask how much elemental calcium is in the pill, not just how large the pill looks. Many people do better splitting calcium into smaller doses because absorption is limited when too much is taken at once. And if you have a history of kidney stones, kidney disease, high calcium levels, parathyroid problems, or you take certain medications, you absolutely want medical guidance. Vitamin D also needs respect. It is fat soluble, and more is not automatically better. The adult upper limit is 4,000 international units per day, unless a clinician is treating a documented deficiency and monitoring you. Very high vitamin D intake can raise calcium levels too much, potentially causing nausea, weakness, confusion, kidney stones, kidney injury, and abnormal heart rhythms in severe cases. So a practical pattern might look like this. Get calcium mostly from breakfast and meals. Yogurt, milk, fortified foods, leafy greens, fish with bones. Take vitamin D with a meal that contains some fat, such as eggs, salmon, olive oil, avocado, or nuts, because vitamin D is fat soluble. And do not assume that a 10,000 international unit bottle is better just because the number looks powerful. Next comes vitamin B12, and this one is deeply personal for many older adults because it touches memory, nerves, balance, and independence. If you have ever felt tingling in your feet, numbness in your toes, burning sensations, trouble with balance, unusual fatigue, brain fog, or moments when your memory seems less reliable, you already know how frightening those changes can feel. Many people immediately think, is this aging? Is this diabetes? Is this dementia starting? Sometimes those concerns are valid and need a full medical evaluation. But sometimes one overlooked nutrient is part of the story. Vitamin B12. Vitamin B12 helps make healthy red blood cells, and it is essential for the nervous system. One of its roles involves maintaining myelin, the protective covering around nerves. Imagine your nerves as electrical wires running from your brain and spinal cord to your feet, hands, muscles, and organs. Myelin is like insulation around those wires. When B12 is low, that insulation can suffer, and nerve signals may become less reliable. This is why B12 deficiency can cause numbness, tingling, balance issues, weakness, mood changes, confusion, and memory problems. In some cases, neurological damage can become difficult to reverse if deficiency is missed for too long. That is why this is not a small topic. Here is the part many people do not know. You can eat meat and still be low in B12. You can eat eggs and fish and still not absorb enough. B12 from food is bound to protein. Your stomach acid and digestive system have to release it, and your body needs intrinsic factor to absorb it properly. As we age, stomach acid may decline. Atrophic gastritis becomes more common. Some people develop absorption problems, and then medications enter the picture. Metformin, commonly used for type 2 diabetes and prediabetes, can reduce B12 absorption and lower B12 levels over time. Acid-reducing medications, including proton pump inhibitors such as omeprazole and lansoprazole, and H2 blockers, may also reduce absorption of B12 from food when used long-term. This does not mean these medications are bad. It means they should be used with awareness. Before you blame every tingling sensation on aging or diabetes, ask one simple question. Has anyone checked your B12? Foods rich in B12 include salmon, tuna, beef, eggs, milk, yogurt, cheese, fortified breakfast cereals, and nutritional yeast if it is fortified. People who eat vegan or mostly plant-based diets need special attention because B12 is naturally found mainly in animal foods and fortified foods. Some older adults benefit from oral B12 supplements, and in certain absorption problems, injections may be recommended. B12 is water-soluble and generally has low toxicity, which makes it different from vitamin A or high-dose vitamin D. But that does not mean everyone should blindly megadose forever. The smarter approach is to test, identify risk factors, treat deficiency if present, and monitor symptoms. Now let's talk about folate, also called vitamin B9. Folate is important for making healthy blood cells, supporting DNA synthesis, and helping metabolize homocysteine, an amino acid that can be associated with cardiovascular risk when elevated. Folate is found naturally in foods like spinach, romaine lettuce, asparagus, lentils, black beans, chickpeas, avocado, and other vegetables and legumes. Folic acid is the synthetic form used in supplements and fortified foods. Folate is not the enemy. The mistake is using high-dose folic acid to cover a warning light without checking why the warning light came on. Here is the trap. If someone is deficient in vitamin B12, the body may develop a type of anemia that shows up on blood tests. That anemia can be a clue that leads to diagnosis. But high intakes of folic acid can improve the anemia while the nerve damage from B12 deficiency continues underneath. In other words, folic acid may make the blood test look better while the nervous system is still in trouble. That is why older adults should be careful with high-dose folic acid pills unless B12 status is known. The adult upper limit for folic acid from supplements and fortified foods is 1,000 micrograms per day. This upper limit does not apply to natural folate from food in the same way. Eating lentil soup, spinach, asparagus, black beans, and salad is not the problem. The problem is adding high-dose folic acid pills without understanding B12. A smart pattern is simple. Get folate from food first. If a clinician finds true folate deficiency, treat it, but also make sure B12 has been checked. In older adults, the order matters. Do not fix the paint on the dashboard while ignoring the engine light. At this point, you may be wondering, what should I actually do tomorrow morning? Should I throw everything away? Should I stop all supplements? Should I buy different ones? The answer is not panic. The answer is a reset. I want you to think of this as a 4-month senior supplement reset plan. Month 1 is the month of truth. Do not add a new supplement just because you saw a new advertisement or a friend recommended it. Instead, gather information. Make an appointment with your clinician and ask whether it makes sense to check a CBC, ferritin, iron studies, vitamin B12, folate, vitamin D25 hydroxy D, and possibly kidney and liver function, depending on your situation. You do not need every test every time, but these are the conversations that turn guessing into knowing. During that first month, Joe a brown bag medication review. This is a simple but powerful practice. Take every prescription, every over-the-counter medication, every vitamin, every herbal product, every sleep aid, every powder, every gummy, and every supplement bottle. Put them in one bag. Bring that bag to your doctor, pharmacist, or nurse practitioner. Do not rely on memory. Do not say, I take a little of this and a little of that. Bring the bottles. The label tells the truth. This review can reveal duplicates. You may be taking vitamin A in your multivitamin and again in an eye formula. You may be taking vitamin A in a separate capsule and again in another supplement. You may be taking calcium at the same time as thyroid medication. You may be taking iron without any clear reason. These are fixable problems, but only if they are visible. Months 2 and 3 are the food foundation months. The goal is to make food carry most of the load because food brings nutrients in a pattern the body understands. For breakfast, you might use Greek yogurt with berries and a few almonds, or eggs with spinach, or fortified oatmeal with milk. For lunch, try salmon, tuna, sardines with bones, a turkey and avocado sandwich, lentil soup, black bean chili, or a big salad with romaine, chickpeas, olive oil, and vegetables. For dinner, think about lean protein, beans, cooked greens, sweet potatoes, broccoli, tofu, eggs, or canned salmon patties. This is not fancy medicine. This is the kind of food pattern that quietly supports bones, nerves, blood cells, muscles, and metabolism. It gives vitamin E from nuts and seeds, beta carotene from colorful plants, calcium from dairy or fortified foods, vitamin D from fortified foods and fatty fish, B12 from animal or fortified foods, and folate from greens and beans. Month 4 is the targeted supplement month. This is when you and your clinician look at the test results, symptoms, diet, medications, and risk factors. If vitamin D is low, supplement appropriately and recheck if needed. If B12 is low or you are on long-term metformin or acid blockers, decide on oral B12 or another plan. If iron is low, find out why and treat it carefully. If calcium intake from food is low and bone risk is high, discuss a calcium plan. This is targeted. This is not random. Now let's make timing practical, because timing can be the difference between a supplement helping and a supplement interfering. If calcium is part of your plan, many people take it with breakfast or another meal, especially if it is calcium carbonate, which absorbs better with food. Calcium citrate may be less dependent on stomach acid, but you still want to follow the label and your clinician's advice. Do not take more than your plan requires, and remember that total calcium includes food plus pills. Vitamin D can be taken with a meal that contains some fat. This could be lunch or dinner with salmon, eggs, olive oil, avocado, nuts, or another source of healthy fat. You do not need a greasy meal. You just need enough fat to support absorption. Iron, if prescribed, should usually be separated from calcium because calcium can interfere with iron absorption. Many clinicians recommend taking them at least 2 hours apart and sometimes more depending on the situation. Iron can also interact with certain antibiotics and thyroid medication, so ask about timing. Vitamin C can improve iron absorption, so some people take iron with a small glass of orange juice, but only if that fits their medical situation. B12 is more flexible for many people. Some take it in the morning, some later. The important part is consistency and using the form and dose recommended for your situation. And please avoid the one handful mistake. You know what I mean. Opening the pill organizer, pouring a pile of capsules into your palm, and swallowing them all at once because it feels efficient. Efficient is not always effective. Calcium, iron, thyroid medication, certain antibiotics, acid reducers, and other medications can compete or interfere with absorption. A smarter schedule can protect the value of what you are already taking. Now we need to discuss the part most supplement videos skip, and it may be the part that protects you from wasting your prescription medication or putting yourself at unnecessary risk. Supplements can interact with medications. The first major interaction is warfarin and vitamin K. Warfarin is a blood thinner used in people with certain clotting risks, atrial fibrillation, mechanical heart valves, or other conditions. Vitamin K helps the body make clotting factors. Leafy greens such as kale, spinach, collards, romaine lettuce, and broccoli contain vitamin K. The answer is not to stop eating greens. Greens are healthy. The answer is consistency. If you take warfarin, sudden large changes in vitamin K intake can affect how the medication works. Eating a huge kale salad one day and no greens for the next 5 days can create more variability. Medline Plus advises people on warfarin to eat consistent amounts of vitamin K containing foods on a week-to-week basis, so do not fear vegetables. Be steady and tell your clinician about your normal eating pattern so your dose can be managed properly. The second interaction is levothyroxine and minerals such as calcium and iron. Levothyroxine is thyroid hormone replacement, and it is often taken first thing in the morning on an empty stomach. Calcium carbonate and ferrous sulfate can interfere with its absorption. Medline Plus advises taking calcium carbonate or ferrous sulfate at least 4 hours before or 4 hours after levothyroxine. This is one of the most common mistakes I see. A person takes thyroid medicine correctly, then 15 minutes later takes a calcium supplement or a multivitamin with minerals. They are faithful to the prescription, but the supplement may be blocking part of the benefit. If your thyroid numbers are unstable and you take calcium, iron, magnesium, antacids, or a multivitamin, ask about timing. Sometimes the solution is not a higher thyroid dose. Sometimes the solution is separating the pills. The third interaction is metformin and B12. Metformin can be a very useful medication for type 2 diabetes and prediabetes, but long-term use may reduce B12 levels. If you take metformin and you have numb feet, tingling, burning pain, balance trouble, fatigue, or memory concerns, do not assume it is only diabetes getting worse. Ask whether B12 has been checked. This one question can change the direction of care. There are other interactions too. Some antibiotics should not be taken with calcium, magnesium, iron, or zinc because minerals can bind the medication and reduce absorption. Blood pressure medications, diuretics, acid blockers, seizure medications, and cholesterol medications can all have nutrient relationships worth reviewing. This is why the pharmacist is one of your best allies. Pharmacists understand timing, interactions, duplicate ingredients, and label confusion. So let me bring this home in the simplest way. First, test before you take. Your body deserves evidence, not guessing. Second, food first, pills second. Most nutrients should begin on the plate, not in a bottle. Third, more is not better. Enough is better. With fat-soluble vitamins and minerals, too much can become a burden. Fourth, iron is never a guess, especially for men and women after menopause. If you need iron, treat it. If you do not add it casually. Fifth, check B12 if you take metformin, long-term acid blockers, eat vegan, have stomach problems, or have numbness, tingling, balance issues, or unexplained fatigue. Sixth, separate minerals from thyroid medication and certain prescriptions. Timing can protect the medicine you already paid for. Seventh, bring every bottle to your doctor or pharmacist, not just prescriptions, every vitamin, every gummy, every herbal supplement, every powder, every natural product. Natural does not automatically mean safe for your specific body. The point of this video is not to make you afraid of your cabinet. It is to give you back control. The safest supplement is not the strongest one. It is not the one with the biggest number on the label. It is the one your body actually needs, at the dose your body can use, taken in a way that does not interfere with your medications. Your goal is not to own more bottles. Your goal is to keep walking with confidence, thinking clearly, sleeping better, avoiding preventable falls, protecting your liver, supporting your heart, and staying independent as long as possible. So tonight, before you take your next handful of pills, do one thing. Line up the bottles, look at the labels, notice the duplicates, notice the high doses, notice anything with iron, vitamin A, vitamin E, calcium, vitamin D, folic acid, or B12. Then write down your questions and bring them to your doctor or pharmacist. And if this helped you, comment bottle check below. That tells me you want more simple, practical checklists for safe supplement use after 60. Also, share this with someone you love who has a cabinet full of vitamins, because one careful conversation may prevent months or years of taking the wrong thing for the right reason. I'm truly glad you spent this time with me. Take care of your body with wisdom, not fear. Test first, eat well, supplement only with purpose. And remember, the goal is not just to live longer, it is to stay strong enough, clear enough, and confident enough to enjoy the life you are working so hard to protect.